Now, let's talk about the Oregon State Hospital down in Salem. Tension and trouble is boiling over in Marion County with a battle brewing over the release of mental patients. It features state courts testing federal courts, a federal judge putting his foot down, and a new lawsuit against the Oregon Health Authority and the superintendent of the state hospital. There is a lot that is happening this week, so let's start with a little background before we dive into some court documents. Our team has been reporting on problems at the state hospital, which deals with people who have mental illness, for a long time now. There are staffing shortages and a huge uptick in aid and assist patients. Those are people accused of crimes who are deemed unfit to aid and assist in their own defense. So they're sent to the state hospital to get treatment and hopefully restore some competency so they can understand the charges against them and then move on through the justice system. That's how things are supposed to work anyway. But for decades, the process has been mired in muck. Aid and assist patients were often waiting weeks, even months, in local jails before a bed opened up at the state hospital there. So Disability Rights Oregon sued way back in 2002, arguing those patients need to be admitted quickly instead of wasting away in a jail cell. At the time, a federal judge said, "Yep, you are right." He wanted the patients in the state hospital within 7 days of being brought to jail. But as the number of aid and assist patients kept increasing, the hospitals filled up and still could not keep up with that order. So that 2002 lawsuit, it dragged on and on and on. That is, until September of last year. Now that's when a federal judge here in Portland gave strict time limits for how long people can receive care at the state hospital before they're shown the door. For misdemeanor crimes, they could only be at the hospital for up to 3 months. For nonviolent felonies, 9 months. For violent felonies, up to 1 year. After that, the hospital is supposed to return them to the counties they came from with the assumption that they've approved enough to aid in their own defense. Now, the order was meant to keep the wheels turning at the state hospital and lower those wait times for people sitting in jail. At the time, Marion County and others appealed, saying, whoa, 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 whoa. You can't just set these people free in our community. We don't have the resources that they're going to need outside the hospital. The federal judge initially said, too bad. But earlier this summer, he amended his order, allowing the counties to request those longer stays at the state hospital for some patients. That same order said people charged with non-person misdemeanors are not going to go to the state hospital at all. And that does seem to be working. Data from last month showed the state hospital was finally in compliance with that 7-day court order from way back in 2002. So things appear to be on the right track in that regard. So everybody's happy, right? No. In a recent court filing, that federal judge, Michael Mossman, wrote that state circuit court judges in Marion County have issued orders prohibiting the release of patients from the state hospital, going directly against his previous orders. And you can bet Judge Mossman was a bit perturbed to learn that his order was being ignored. So he pulled out what is basically his ace of spades, so to speak, the supremacy clause of the United States Constitution. Now, in case you're a bit rusty on that, it's Article 6, Paragraph 2. It basically says that when federal and state laws or orders go against each other, federal wins every time, period. So Mossman wrote that even though Marion County judges were stopping the release of patients, their orders were actually void because his previous federal order. Mossman was basically putting his foot down, telling the judges there to knock it off. So that's got to be the end of it, right? Of course not. The problem of mental health patients being released in Salem was not over, not even close to being over. On Tuesday, Marion County sued the Oregon Health Authority and the state hospital. This week, we talked with Marion County Commissioner Colm Willis about why they took this drastic step.
The state is responsible by law for taking care of mentally ill individuals who require a hospital level of care and have committed crimes in our community. So for the state not to provide care to these individuals, the state is violating the law. That's what this lawsuit is all about. The reason we sued the state is because we just want the state to comply with the law and take care of the individuals that the legislature has said it's their responsibility to take care of. This is a crisis. This is a crisis in our communities. The reason why we're seeing the levels of homelessness, the reason we're seeing the types of livability crimes in our community recurring over and over and over again is because there are individuals who have serious mental illness, and the state is not providing the level of care that they need for them to be safe and for our community to be safe.
Willis, the commissioner there, says Marion County has tried to work with the health authority for over a year to figure this all out, going to the courts though, but clearly that has not worked. He claims the state hospital has been mismanaged for years. He wants leaders there held accountable to help fix the problems.
We want Oregon Health Authority to actually come to the table and to come up with real solutions. The only solution we've seen so far is the Oregon Health Authority has decided to release more individuals, more sick individuals who have committed crimes back into our community without adequate resources. The Oregon Health Authority has over a third of the state budget. They had over a $30 billion budget in the last biennium. We just need them to take this issue and make it a priority, and instead of brushing us off or pushing the counties away when we tell them how much our communities are suffering, we need them to come to the table and come up with real solutions for these individuals.
It should come as no surprise that the goal of the lawsuit is to get a judge to force the state to increase beds and resources for aid and assist patients at the state hospital. We'll see where it goes from here. But what about you? What do you think about all this? This is surely a bit of a drama that will not be over anytime soon. Send us your thoughts on it, will you? Email us. The address is thestory@kgw.com, or call and leave a voicemail. The number is 503-226-5090.